Good afternoon and welcome to the Airden Berlis LLP webinar. Today's topic is one on everyone's mind, the COVID-19 coronavirus, assessing the risk and managing the workplace. We'd like to thank you all for joining us today. It's an emergent topic. It's something that we thought we needed to get out to human resource professionals and the legal profession as well, because there's so many questions that are being asked and there are very few answers in many cases. Joining me today are my colleagues, Michael Horvat and Daria Paragodova. We're going to take you through what is a very practical approach to the employment issues which are arising as a result of the onset of the coronavirus. So a couple of things. This is what we're going to go through. A couple of things we want to stress. You know, it's the old joke, I'm not a doctor, but I play one on TV. We are not doctors, so we are going to stay away from telling you exactly what to do or when to do it from a medical perspective. What we do know is that there is a lot of information and lots of it consistent on how it can be transported and some of the steps that you should take to ensure that you're as safe as possible from getting the virus. However, anything that has to do with exact and precise medical information should be on the consultation of a medical practitioner. Also, there are really three professions you should be looking at here. One is legal HR, which is what we're doing today. The other is medical, which is what we just said. And the third is going to be your IT systems and your IT people, because for those people who are going, or for those businesses that are going to have people working from home, you need to ensure that you've got the right processes, that you've got the right software, because there may be people who have to be self-quarantined or quarantined for a period which they must work from home. Easier in an office environment than a manufacturing environment, we admit, but that's exactly where we're at today. So all of this information should not be taken from a medical perspective, but a management perspective. We are seeing the impact now. We're seeing the government reactions both in North America and globally. For example, we just heard that the California legislation, which prohibits gatherings of more than 1,000 people, that's going to mean that NHL games and NBA games are probably going to be played in front of nobody. It's already happening in Europe. And we want to take you through quickly just to this map. This is probably outdated as we speak. It's moving so quickly. And we encourage you, and Michael and Daria will both talk about this, to keep up with government websites that will give you information on precisely where everything is, including new information on where new infection rates may be and where they are. We've just heard in the paper this morning about a mining conference that occurred where there was an infected individual. All of those things are moving targets. We need to understand them and need to keep atop of them. So this gives you a sense of the enormity of it. And you're going to hear comments, it's just a common flu. Why do we care? Well, we care for a lot of reasons. Aside from health and safety and from our employees and our own health, we also see what the impact is on the economy. And that is kind of reaching disastrous and epic proportions. This is why we're worried about it. So let's get into it. And I'm going to ask Michael to take you through a little bit, just as you see what we're doing to go back. We're going to talk a little bit about COVID, about the occupational health and safety overview, because that really is the framework we're talking about, your legal obligations and due diligence. And then we're going to get to compliance and, most importantly, managing and what an employer can do. We have a list of about 6 pages of questions here. You are all engaged. We have over 3,000 people signed up. So that's really what we want to do, is give you a practical approach to this. Michael?
Thank you, Lorenzo. So just as far as a brief background, and again, not from a medical perspective, but from a fundamental HR perspective, as far as what COVID-19 is, it's one of a large family of viruses that are similar to the flu, but clearly, with respect to the prior side, is indicating a high degree of transmission. It is largely, if not exclusively at this point, to our knowledge, transmission from surface to surface and directly from person to person. These are important factors because this is going to guide some of the principles and procedures that we're recommending as far as your due diligence on cleaning, on reminding employees of their obligations on cleanliness and so forth. Also, it is a disease that at the moment is currently wreaking havoc with respect to older people who get it or people who have compromised immune systems. This is important because if your employees come forward, or if you're in an employment sector where largely is older workers, or if you've got an employee who does have a chronic condition or a prior condition, you're going to treat that employee differently with respect to any concerns or qualifications that employee may have as to how they're interacting with potential COVID issues. So right now, with respect to information, the key here has been, and I think a large focus has been travel and travel issues. Clearly, we're beyond the original infection situation in Wuhan, China. The first case in Ontario was already identified in January 25th. So we're getting into 2 months now into this. As far as what the federal government is saying with respect to travel advisories, you have 3 countries at a level 3. That's China, Iran, and Italy. Italy just 2 days ago with respect to banning all non-essential travel and essentially at this point treating them as no-go zones for anyone. And the airlines are taking that approach. Other countries are identified as level 2. That is right now special precaution, Japan and South Korea, as well as other countries that are identified as potential hotspots, but not yet travel prohibitive. As far as the Ministry of Health is concerned, their situation is that anyone traveling to China, and likely now with respect to anyone going to any of the level 3 areas or coming back, are to contact their local public health unit and to monitor themselves for 14 days after returning. So we're into now a situation where those people should be treated as mandatory. The word I'm looking for is quarantine situation for those in not self-quarantine, actual mandated quarantine, and maybe up for testing with respect to protocols put forward by Ontario. So for at least those 3 countries now, but could be increased, is a situation in which they're going to be monitored and reviewed by the province.
And that's going to inform our later comments with respect to what you can do with certain employees. If employees have traveled to those areas, and particularly the level 3 areas, then there may be very well a compelling reason to say that you're not coming back into work.
We'll talk about this further on. One issue is cruises. That has been identified as a concern officially by the federal government and health authorities, federal health authorities, but as yet not been leveled to a level 3. It is, though, strongly recommended that those individuals not go on any cruises of any kind. Daria?
Thanks, Lorenzo. Thanks, Michael, and good afternoon, everyone. So just carrying on with some specifics about what we do know, the symptoms of the virus are quite consistent with other respiratory infections, including the flu. So they can include fever and cough. And as a result, the province of Ontario has been quite cautious in testing patients who have flu-like symptoms just because they are quite similar. So we've got some stats that you can see there in front of you, but these are current as of March 11, 2020, although I should add another caveat that they are changing so rapidly that even since we put this together just a number of hours ago, these specific stats, the confirmed positive cases in Ontario have gone from 36 to 41 this afternoon. So the other stats may be evolving and changing, but give or take, what we know is that there have been approximately a total of 3,400 patients who've been approved for testing in total. Out of those, there are 41 now that have been confirmed positive, roughly 2,900 negative. There are still a number of cases that are under investigation, so they have not yet gone through the elapsed recommended quarantine period, which would rule them as negative or positive, and a small number of cases that have now officially been ruled as resolved. In terms of how the Ontario government and the Ministry of Health is actually preparing for this gradually evolving and rapidly evolving situation, the focus has largely been on detection and isolation. There are a number of announcements happening even this afternoon, but that seems to be the general approach. One of the measures has been that the virus has been added as a reportable disease or condition, which basically means that under the health Promotion and Protection Act. There's a regulation which requires certain healthcare providers, laboratories, and certain specific other professionals like school principals, et cetera. There's a defined list to report incidents to their local public health unit. So that's basically what that means. And COVID-19 is now part of those reportable conditions. So the rationale there is really that it allows the province and the ministry to take as quick and effective and necessary measures to actually be able to track the evolution of this disease, and also to be able to complete tests within a very quick amount of time in order to actually have a very accurate rate of infection. Just by way of comparison, obviously, one of the things that's on everyone's minds is how SARS evolved, and it seems like we were trying to remember exactly what year this was, because it feels like in the distant past, but it's actually only in 2003 that we dealt with quite a similar situation. And with specifically with relation to employment, we saw certain changes around employment insurance and benefits in reaction to SARS. At that point, the quick bullet points there are that there was 15 weeks of special benefits approved. There wasn't any immediate requirement to supply evidence or medical certificates to prove symptoms or that actual positive having of the condition. And there was the waiver of the then 2-week waiting period to be approved for EI benefits. And most of you will have heard the announcement by the federal government that the current 1-week waiting period for EI has now been waived to respond to this condition. And for some clarification, that applies specifically to those in quarantine or those that have been told to self-isolate. As far as we know, and we're still waiting on clarification on this, but this does not apply to voluntary self-isolation, which we understand a number of individuals are also imposing on themselves. So we're also just one last point is that we're still waiting to get confirmation on exactly the type of evidence that's going to be necessary in order to prove whether or not and how the virus has affected you. That's
a really important point, because we're going to talk a little bit about self-quarantining or telling employees that they have to stay at home. And there's a lot of issue, particularly in the media, about how that might be unfair to employees. They're not getting paid. They're being told to stay at home. There's a difference in approaches between union and non-union, but at least we know now that there's going to be perhaps an EI response to that, and that's important to remember.
And given the fluidity of the situation, in particular the concerns with respect to the economy, we do expect that the government's going to be very proactive with respect to stepping into that position. It's a constant theme with respect to questions of the Prime Minister, as well as in questions of the Premier, as to what's going to happen if, in order to be a good community employer, you're requiring individuals to self-abstain themselves from the workplace. How can they be denied benefits at this point? I think we're confident that that EI situation is going to be proved to be a big and important factor. Also, it's going to be just, quite frankly, structurally difficult for EI to differentiate between those who are being directed to quarantine and those who are self-directing quarantine.
And so there's a lot of issues swirling around here. And one of the things that, I did an interview this morning, and one of the questions I was asked is, well, why don't employers just give 7 or 8 days to employees, or 14 days of pay, so that they can get through this period? So EI is one of the responses to that. But the other response is that you're asking employers to do this in the midst of what is probably going to be a crisis in terms of their own business. And the ability to do what they do, given perhaps dropping employee levels of engagement and ability to attend work. So it's going to be an economic issue for employers. It's not just that they don't want to pay. There's a real and present economic danger, particularly in the travel and retail and service industries. This is hitting huge. And so that's why I think we want to take this back to what the obligations are at a very base level. And that's the Occupational Health and Safety Act. You are all aware of this legislation. And this applies because what we do have is a potential health and safety risk within the workplace. So because it now has to do with people that are together in the workplace and a virus which may spread, we have the rules of the Occupational Health and Safety Act. And that is essentially, right, very simply stated, to ensure that workplace hazards are removed from the workplace, right? That's what the Act does. So when we're looking at how that works, again, no new news here, but 20 workers or more, you've got a joint health and safety committee. aside from anything which is kind of statutorily required, if you have a joint health and safety committee and these health and safety issues arise, things like people in the workplace, concerns that are expressed about people who may have been exposed, about whether people will refuse to work, that should be dealt with as a health and safety issue. That means engaging the health and safety committee and working through it. Where does that take us? Well, we have the right to refuse work under in Ontario under the Occupational Health and Safety Act and across the country under similar legislation. So there are rules when somebody doesn't want to work. And remember that the concept here is one of reasonableness. They are entitled to refuse work, all right, but where the conditions are likely to endanger them. Important definition. So somebody's perception of a risk is not necessarily a reason to refuse work, but you must investigate. You got to wrestle this to the ground and find out what the base root of the refusal is, and you have to make a decision, which usually, if you have a joint health and safety committee, should involve that committee. So we need to be very clear that the process has to be complied with. It actually will make it easier for you to deal with these issues. So the regulation and the legislation itself says you must take all reasonable care. It's a due diligence standard, right? And it includes a person who contracts for the services of one or more workers, which means it can also include independent contractors and subcontractors who are in your workplace. Again, that's all not new law, but when you look at the introduction of this virus and how it may impact anybody, it's not going to be discriminating in terms of who it hits. That's a very important distinction. Michael?
So when it comes to due diligence in respect of COVID and these situations, health issues, what are the steps to compliance? Due diligence is a demonstration by the employer, including their managers and supervisors, that they've exercised and taken reasonable precaution and steps to try to avoid a bad thing of happening. You've got to be able to demonstrate this, that what you have done is you've looked at the issue, you've identified it, and you've addressed it to the best of your capability. Daria is going to take us through the steps, but really what does that mean? Due diligence means that you're identifying, assessing, and addressing risk, that you're then developing policies and procedures, you're training people, and you're monitoring the situation. In a fluid situation such as this, there is an additional situation of a mistake of fact. That is that you have acted honestly and reasonably in the belief of a certain element of, either a government authority or medical authority indicating that this is the proper procedure, this is the recommended procedure, and you have acted on that, you haven't ignored it. If it ultimately proves that that was not the proper course of action, you still have a defense and you still have a reason and a compliance matter in which you've actually complied with the Occupational Health and Safety Act because you took that honestly and indicated that you had followed direction as you were expected to do. So in situations such as this, where the gravity of the situation is unfortunately dire, you are obligated to try all those opportunities, and your diligence has to be demonstrated in actual process, procedure, and implementation, and Dash is going to take us through that.
So there on the slide, we've identified the 5 steps that we're going to take you through, and we'll jump right in. So the first step that we recommend is identifying, assessing, and addressing the risks. The first of that is practical, but nonetheless very important to keep updating information. So for yourselves as leaders within your organizations, make sure that you have the current information, follow up. As we've said, but we'll keep saying, it's a very rapidly evolving situation. So make sure you're checking back in with the appropriate government resources, as well as the best information you can get to make sure that you're providing the correct information to your employees and to each other as well. Take direction from provincial health authorities. Right now, in the age of the internet, there's a lot of opinions out there. There's a lot of false information. There's a lot of, I hate to use the term, but something news. So we will, for knowing that, just be careful in terms of, especially when things become a bit dire and there's a little bit of a fear state and a panic state, it's very easy to get trapped by going down the rabbit hole of the wrong resources and information. So make sure you're getting it from the sources that really do have just that, the best information. This is a good opportunity to engage your joint health and safety committee. So perhaps 1 or 2 two of the members of that committee might be designated to be the ones to actually continuously monitor and get the most up-to-date information. And as a committee, they really should be. This is a perfect opportunity to involve them so that you have a group of individuals sharing knowledge and resources to best decisions for your organization. Step 2 is written policies and procedures. No doubt most of you will have quite either advise or have robust policies in your organization, and some of them may cover situations like this, but perhaps not specifically enough, and it may actually create the need to implement new policies, such as ones related to travel, etc. So in that situation, you want to involve management, supervisors, workers, because you want to understand the unique requirements and needs of all of those groups of people and what their work requirements might be. For example, something that we've seen is, asking the variety of employees what level of effectiveness they might be in, should they have to work from home, should they not be able to come into the office, etc. So really just involving and engaging in the conversation those individuals. You want to review your current work procedures, the ones that you already have in place, as well as employee, client, and visitor interactions. So what is your protocol on non-essential meetings? Is there an alternative way to have a client meeting? Can it be done by video conference? Can it be done by phone call? And what is based on the BES resources available to you, what is your decision in terms of how you want that to proceed? After that, you'll actually prepare a written policy on company implemented response and requirements. So some of the things I just mentioned, travel, meetings, working from home options, IT requirements, supplies, insurance, all of those very practical things, but that may have specific considerations knowing what we're dealing with now. And the last thing is you want to keep updating employees and the policies as circumstances change. So, Michael took you through the current situation with level 2 or 3 affected areas at the moment. We've heard from a number of employers that their current approach is to limit and travel to level 2 and 3 areas, and also require a certain time frame of quarantine if you have traveled or if someone in your household has traveled to those areas. But that may change, and the areas that we're dealing with may change. So make sure that you're updating your policies as things evolve.
And one thing in terms of policies and procedures, so our firm here had a very robust communication that came out last week, which said, tell us where you're traveling. Non-essential business travel is going to be eliminated. But if you're going to a hotspot, you have to let us know. They also required us to put information together as to our work at home options, our capabilities, what systems we were working off of. From a policy perspective, this is also very important from a unionized, if you have unionized employees. If you promulgate independently, unilaterally, if you put in a policy which the union doesn't agree to, management generally has the right to do so. The question will be whether the employees who say, well, I don't have to comply with this policy, or I'm not staying at home, whether that's a reasonable policy. And there's all kinds of case law on the reasonableness of a policy. It's an old case called the KVP, where they have to be given notice. It has to be applied consistently. All of those things. But having the policy to begin with and having the right policy with the right wording is important, particularly in a unionized environment.
And it's going to assist you with respect to your engagement with the Joint Health and Safety Committee and references to Ministry of Health or other local health authorities to ground the policy. This is the reason why we're requiring you to do X, Y, and Z. This is the reason why we're requiring you to disclose where you're going, which ports of call are you going to, which flights or cities are you flying through. We want all of this information because we need this for tracking information. We need this for our own due diligence, and we need it because we're being requested and required to do so by the appropriate authorities. That's all going to lend in part and parcel to the reasonableness of your policy.
Yep. Okay.
Step 3 is training. So just as you would with other policies that you have or that you advise on, you want to make sure that in addition to actually developing the robust policies, and you make sure you disseminate them appropriately to your workplace and your employees. So inform employees of the new procedures, the new policies, email them around, post them in certain spaces, do what you need to do to make sure that folks are actually aware of what the protocol and procedures are. And you want to make sure that they're effective and that they're effective as they evolve and change. So just as you would plan for a contingency, just as you have, to use a trivial example like a fire drill, you actually think through how those things are going to go. You don't just wait till the worst case scenario to try and to test them out. So think of it from that perspective. If you're putting in measures, make sure they're actually effective and do the best you can to measure how that will play out. Step 4 is supervision and monitoring. So, we've said it a number of times, of follow up to make sure you have the best information, follow up to make sure that the policy is working. This is important. So the policies and procedures will only be as good as their enforcement. So with some of the examples we've used about quarantine following travel to level 2 and 3 areas, make sure that non-compliance with anything you put in place actually has consequences. I think not just as employees, but as individuals, we all think that we're immune, but we're only immune until it actually hits us and actually affects our workplaces. So make sure that no one's not taking it seriously. Exemptions and process. So this is more of a case-by-case point, but we did want to mention it because you certainly will deal with situations where somebody says, I know that I'm not supposed to travel to Italy, to Iran, to China right now. However, I have a sick relative. I have to go. This is really important. It's essential. And in that situation, you will have to take that request seriously and have to decide how you treat it. So it really is a case-by-case basis situation where in some circumstances it might be appropriate to afford a paid leave. In other circumstances it may not, but we recommend you do deal with that on a case basis and consult with counsel as needed. As managers and as HR professionals, you will be looked to give direction in a situation like this and provide some calm and certainty. So all of the things that we're talking about, make sure that you have an organized set of information that you're ready to deliver and communicate that. Everybody is human and everybody knows that the situation is rapidly evolving. However, it's important to stay as organized and as calm as possible, and some of the tools that we're taking you through should help with that.
Michael?
And then the final step is actually start over from the beginning. And this is going to happen with respect to an ever-evolving and constantly developing situation such as COVID. That could be done on a weekly basis. It may come down to even a daily basis as new information comes forward. Importance here is going to be streamlined communications internally will be critical. When you hear from lawyers, you need to have a policy, you need to have a procedure. I think some people will envision, oh my goodness, it's going to have to be 5 pages long. We're going to have to get a whole bunch of people to bless this situation before we put it out. It does not have to be that detailed. You can get this information out quickly to employees upon the management making a decision as to how they're going to approach the COVID virus. It can be a memorandum. It can be an email. It just has to list and address the issues that the company wants to address. So what is your information with respect to travel and other policies and procedures? Have someone dedicated to this. This can be a combination of management and your joint health and safety committee, but have a couple of people who are the go-to persons with COVID. They're going to be your ability to respond to this. They'll also be tasked with updates. And you don't have to reinvent the wheel. You're amending this process potentially on an ongoing basis. Maybe it's as simple as adding additional countries. Maybe it's responding to particular employee concerns. If you keep the avenue of questions open, you might find that a lot of your employees are going to direct questions to you that are going to be information to other employees. For example, we had a sort of off-the-record discussion. I had an off-the-record discussion, and it came up, what were the insurance companies doing? What were they doing with respect to travel insurance, cancellation insurance? What happens to employees who go to a country that's not yet under a quarantine, such as Italy, but then becomes quarantine? Well, what happens to their coverage? They may not be able to get out. Does it continue? You need to interact with your insurance companies to understand what their benefit is. Right now, at least from one example, the insurance companies are indicating that they will at least cover everything except travel cancellation. That is basically off the board from everyone and anything, anywhere. But they are apparently, at least a couple of insurance companies are making exceptions to say, we will extend beyond out-of-country coverage if you're stuck in a quarantine situation in this special circumstance. But make sure your insurance company, on behalf of your employees know that, and then distribute that to employees so they're making the best decision with respect to travel plans. So where are we with respect to what you should be doing? Well, get your employees to provide you contact information, including cell phone, email address, and home phone number. Your ability to communicate with your employees is going to be critical in this situation, so get their updated contact information. Again, email is a good opportunity. If you've got an intranet situation, get that connection. Understand your IT capability of your employees. Can they call in? Can they contact in? What are their options with respect to getting information? And then also, what are their structures if we're going to be having a work from home situation? Remind your employees to be vigilant with respect to their communication or spreading of the disease. Ask them, requiring them to wash hands frequently, provide hand sanitation at the desk, in the workplace, at several points of contact, whether it's at the reception, first getting into the facility, at the washrooms, everywhere. Try to make this as easy as possible and monitor supplies. There is as usual, a run on these kind of things. I don't hear of that yet in Ontario, but it's good for you to monitor it. And remember, soap and water is just as good as long as employees are washing their hands for 20 seconds. I think yesterday I heard saying happy birthday twice. That's a good indication as to how long they should be washing their hands. And then, reminders. Don't touch your face, avoid coughing out loud, sneeze into your arm, and avoid skin-to-skin contact. This is an indication of ceasing handshaking and could be a situation in respect of ceasing having actual face-to-face meetings in large groups. With regard to policies on travel, prohibit business travel to or through affected countries. Ask all employees to disclose personal travel to or through affected countries, either in the last 30 days and on a go-forward basis, and then determine whether or not those employees need to be quarantined upon return for 14 days. And we have March break coming up. This has been a very delicate situation. At this point, cruise ship situations are directed to avoid cruise ships. And so all companies should be considering those employees who've indicated that they're in a cruise ship situation as to whether upon return they should be self-quarantined for 14 days. Finally, as you have control of the office, so you have the ability to limit in-person meetings. This is going to be, of course, very difficult with respect to production employees, a little bit easier with office employees. But really, it's about considering your options for work-at-home situations.
Yeah. Just as a side note, my mantra for my whole life is to avoid cruise ship situations. So I'm good on that one, I think. So let's talk a little bit about the changes to the workplace as well and the office procedures. So you're going to get a lot of requests, and you may very well get requests which are just kind of have to do with a situation that is not of the employee's making, but for example, school cancellations. So let's say that we've got somebody who says, my kids are home from school because they are no longer going. I have nobody to take care of them. I need to work from home. You should be open about those requests, and you may very well want to be in a situation where you can look at them and expedite absence requests if necessary. But if there's disclosed contact with suspected cases of COVID, then you need to address that, and you need to address it quickly. You can't wait on it. So as Michael said earlier on, you need to have designated people that are dealing with it. Eliminate the need for production of a medical certificate prior to absence and refer employees to testing. Now, there is an issue with respect to testing. If an employee says they've been exposed or a family member has been exposed, and then they say, but I think I'm okay, or I went to a walk-in clinic, I think you can say to them, no, we require you to confirm, just like a return to work on any other absence, we require you to confirm, all right, that you've actually been cleared to return to work, particularly in an exposure situation. That is an element of due diligence, all right? And further, if you're ill with a respiratory-like illness, then you should look, and we talked about this earlier on, there's going to be a vulnerable group, and those vulnerable groups need to be addressed. In advance, you may want to look at them in advance and say, look, we're going to try to figure out a way so you're not exposed if necessary. That may mean some pushback from the employee because they may not want to stay at home. If that's the case, you'll have to make a decision. So here's the big one, all right? What about pay? That's the question we're getting. What do we do about pay? because there's personal leave issues, there's unionized collective agreements, right? There are individuals who say, I'm not staying at home. And by the way, there might be employees who say, yeah, I might, I'm coming back, I'm going to self-quarantine for 14 days. I think I'm sick. Can you make sure I get paid? All right. A lot of that, as Michael said, is you're going to have to find out from your disability carrier exactly what that is and the level of information that will be required. All right. A lot of employers, though, are self-insured or have just a third party, an ASO arrangement. In that case, you have the ability to say to the insurer, just to prove it. And you can make that determination. You're going to have to determine whether you want to extend pay for those people who have been exposed or sick. But if they're under a benefit program, or you can make that decision, it's something you should consider as in any other sickness or disability. It doesn't matter. You can consider the use of a banked or lieu time or vacation time. That is an employee benefit, though. And if you say you have to use it, right, that might be an issue. I think what we're looking at is unpaid leave, access to EI for those people who are not necessarily sick, and for those people who even might, and I'm going to say it, who voluntarily travel and come back and say, now that need to be self-quarantined, to say that's an unpaid leave of absence because it was of your own volition, it was your own choice to go to that place this morning. And I think that's very important that we make that distinction. We talked about this a little bit early on, pay for unionized employees. That might very well be under collective agreement. Check your collective agreement. You'll have to look at family and medical leave provisions. There might also be accommodation requests for, like we said, family status, for example, elder care, child care, people who might get sick from this and whether they qualify for another leave because one of their family members got sick as a result of COVID. You have to keep those. Use the same protocol that you do in any accommodation request. All right, do the research, find out some information, make a determination. Now, on confidentiality, this is the other thing, and Michael and I were talking about this the other day, is, well, to what extent are you going to tell people who's been quarantined and who's not? In small workplaces, that might be self-evident. If somebody's been asked to stay at home, people are going to know. You don't absolutely have to say that right from the get-go, but if somebody's suspected in the workplace of being sick and then you want other people to return to work and continue to return to work, they might need to be aware of who that is from a health and safety perspective. And to take on that point and to follow up with a previous slide, part of that is going to be access to your workplace. You're going to have to start asking people who attend your workplace to get their personal information. What's their contact information? Who are they? With what company they're with, and what is their email contact, and what is their cell phone contact, in the event that you either have to contact them, or as a result of their having attended at your workplace, you have an issue of contamination. Additionally, you can ask those individuals who are attending at your workplace, what has been their recent travel experience? Where have they recently traveled? And if they have any concern that they come into COVID contact. Remember, it is your workplace. You have an entitlement to screen, just as you would at the hospital or at the airport, or maybe at the Leafs game and coming up soon.
Thanks, Lorenzo, Michael. Yeah, that was actually Michael's points were a nice setup for this next slide of what can the employer do in the situation. So as we've touched on, make sure you get updated contact information and employee capability to work remotely. So the example I used earlier, I think this is a really good method, and we've certainly recommended it already. Try to get your employees to estimate how effective they would be if they had to work remotely. So how much of their work actually depends on them being in the office in person, and how effective would they be if they had to work remotely. And it can be a percentage, give them, sort of markers. It doesn't have to be to a degree of perfection. However, that could be helpful rather than just asking an open-ended question. Identify key persons and work requirements. So you want to put in, applicable emergency planning for your operations, which we've summarized, long you operate or what backnoves are if the person has to work remotely. Get employee travel information past and planned. We've gotten a number of questions, and the ones that came in just before we started about, can I actually do this? Am I actually entitled to ask for those details? And the short answer is yes, you are. travel screening for visitors to the workplace, and by travel screening, we don't mean, there were some specific questions in the ones we got about actual screening procedures. And again, that's just not our area of expertise. But when we talk about travel screening for visitors in the context of the workplace, when you're asking information about the actual employee travel history, make sure that you're also asking information about those that might be in the household or those that might be in the family with whom into contact. So that's what we mean by travel screening there.
And remember, and Daria put her finger on it, you're going to get a lot of employees to push back and say, you don't have the right to this information. Well, actually, our position is we do. Now, some of this will come out in the wash. It did in SARS. There were arbitration decisions. There were after the entire kind of period of emergency passed. But the bottom line is this. The employers are going to be taking the position that these are requirements for health and safety perspective and to ensure a safe work environment for employees who are under their supervision. That's the position we're taking, right?
This is not going to be an anything goes situation, but given the global nature of this and the impact that's happening, as well as the daily response from the federal government, from the provincial government, from the municipal government, any arbitrator or judge is going to give significant leeway to an employer who is trying to act in the best interest of their employees and in the best interest of visitors, and in respect of trying to follow provincial and municipal guidelines with respect to control and trying to, as they say, level out the curve in respect of COVID to try to resolve this sooner rather than later.
Daria?
One last point to touch on is something we've seen work effectively in terms of getting really easy and up-to-date contact information and travel information is creating a type of live form. So not a physical form that somebody might necessarily have to drop off or scan in, but creating a secure but live form that can easily be updated as well as things change. The other things to keep in mind for an employer are to, again, stay on top of the changes and have perhaps a key person or persons dedicated to actually keeping on top of them. Use the Joint Health and Safety Committee, as we've iterated, to create updates, create postings, make sure you're communicating with your employees and monitoring announcements and directions as they come from the experts and the folks in charge of this. A very practical note, but an important one, is just to increase cleaning and sanitization efforts around your workspaces. So, you can implement significantly more stringent disinfectant cleanup type efforts. So, either I saw buttons, especially things like that a lot of people are touching on in elevators. I saw just in our own office building this morning, folks wiping those buttons down, making sure that especially things that people come into contact with, door handles, things like that, are properly disinfected and regularly. And in addition to that, providing, disinfectant wipes, sanitizer, etc., putting them all around the office. The more they're in people's faces, the more likely they're to reach out their hand and use them. So just putting them right in people's faces and making sure that they're available.
So what we're going to do now is we're going to take you through three case scenarios. Each one of us will read one. So I'll go, Mike will go, and then Dario will go, and we'll just discuss them very briefly, because we find that this is kind of a specific, each scenario really are things that I can tell you that I've encountered in questions from clients. So we're going to go through them. It'll allow you to at least get a little bit of a practical approach to these things, because, like we say, the questions that are coming up are all very similar in nature in terms of what can be done and what can't be done. So the first one is case scenario. These are all based actually on real situations. So Tricia is an office manager at TechCo. She works out every day at Hulk Fitness, close to the office. She does so generally in the morning before coming to work or during her lunch break. Yesterday, she showed up at the office and said Hulk Fitness posted the following sign: "We've recently been advised that one of our Hulk Fitness members may have been exposed to the coronavirus. We're in the process of investigating and vigilantly cleaning all of our equipment and will be closed until further notice." Now, Tricia, because she's an employee and does her job, comes into contact with staff, with clients, right? That expands out to other staff who have met other clients. So here are the questions which became an issue for this employer. Should TechCo suspend operations and send everybody home? What do we think about that?
Short answer is something to consider, but likely not in this circumstance. One, you don't have a situation in which the Hulk Fitness member has actually been confirmed as exposed to coronavirus. Secondly, the direction from the province and health officials is that the direct one-to-one transmission is of course a concern, but the broader transmission of a friend of a friend of a friend has yet to be demonstrated. It would require extra diligence and may require next steps to keep on top of, but I don't think at this point you're taking the drastic step of having this secondary business shut down as a result of one person who may have had incidental contact with somebody who might have had it.
And that answer applies to should they contact clients. Again, it's the diligence and understanding what the risk is before you jump to contact clients. If there was no exposure, then that's not going to be an issue. And finally, should anybody be quarantined? And if so, what would that entail? I think in this situation, there isn't a quarantinable issue yet, if I can use that word. I just made it up. But if you get to a position where more information comes to the company in terms of an actual risk, that individual employee who may have worked out there, that's where you may consider a quarantine.
Right. For example, the individual that was subject to having been exposed at the fitness center happens to be a personal trainer who happens to be Trisha's personal trainer, and there's relative good information relating to that trainer's COVID situation, then Trisha may be in a subject of being in either a voluntary or directed quarantine situation.
Okay, the next case scenario. Michael, you'll read this one. Go ahead.
As is the case for March break of every year, many employees of the manufacturing companies Auto Parts R Us scheduled and then take March break with their families. Schedules are set far in advance. Plane tickets, cruises, and rentals are booked and paid for the employees' return at the end of the break. This year, employees were told to advise the company if they were traveling to any of the coronavirus hotspots or out of the country. They all comply, and prior to the end of March break, the company learns the following. 2 employees have returned from one of the listed hotspot countries. They advise that a member of their family has symptoms or they were exposed to someone who had symptoms, such as a cruise ship. What does Auto Parts R Us do should these employees be quarantined?
Yeah, I think this one is kind of an easy one in the sense that you've got somebody now who has given you information that they have been exposed to somebody who's been exposed. And I think in that situation, the responsible response is you're quarantined, right? You don't come back to work. We need you to get tested and come back to work when you're clear to return.
Yeah, in terms of what happens if they are not experiencing symptoms or if their families were not exposed. So those are actually 2 quite discrete things. If they were exposed and are not experiencing symptoms, based on the best information we have available right now, we know that symptoms don't actually always show themselves for a number of weeks. And that's unfortunately the reality we're dealing with, which makes it very difficult to track the virus. So if they were exposed and if they're not experiencing symptoms, you may still likely want to take the cautious approach of imposing a quarantine for that period of time. If they were not exposed and are not experiencing symptoms, then we go back to perhaps this is not a situation, I don't think I can use Lorenzo's word, quarantinable situation. Oh, I did, there we go. However, you will certainly want to stay in contact with them and monitor and make sure that that stays actually consistent.
If this is a situation where they've gone to one of the identified parts, then it really is going to be the company that needs to determine we are taking a zero tolerance approach to this. If you've been in one of those countries or are in direct contact with someone who's been in one of those countries, then the situation is, if the decision from a company perspective is, regardless, as Dasha says, there's not been a direct connection, and there's no symptoms, yet still can take the approach, we're going to require quarantine in that circumstance. And then the issue is whether they're going to be paid or not. And as Lorenzo put out, strictly speaking, the obligation to pay is not there with respect to a non-illness absence. However, the company has several opportunities to decide whether they want to provide full pay through short-term disability, leave it to EI. There's a lot of opportunities there to assuage the employee with respect to their concerns as to what's going to happen to their pay situation in their absence.
Another thing to note that occurs to us and has definitely occurred to us as we've been having these discussions is that workplaces are quite different. We certainly work in an office, but there are clients who have workplaces where some form of borderline physical insurance, such as our fictitious, what did we call it? The auto parts are us, or situations where a lot of boxes are moving around, people are handing a lot of things off. That's a very different type of workplace. So this isn't a one-size-fits-all model. You really do have to look at the specifics of the workplace and evaluate it based on those needs. These are best practice recommendations, but certainly where there is more contact, there will be more risk, and that may warrant a different level of response.
And you might get employees coming back because, look, in any situation, there are going to be people who try to take advantage of it. You might get somebody who comes back and says, well, my doctor thinks I should stay off because there might be a possibility that I was exposed, so I have a note, and I'm gonna make an application for, I want to be paid for that time. Well, that's no different than the viability of any medical note which is presented, and you go behind it to find out whether it actually makes sense and it's supportable. But in many cases where people choose to travel voluntarily, for example, really easy example, somebody gets stuck on a cruise ship. They're not sick, but they're quarantined and they can't get back to work. Well, we're not suggesting that these people are subject to discipline. They actually can't get back to work. However, that might be the case if they were told not to travel to that place. That's a different story. But if they can't get back to work, it might be an unpaid leave of absence. You may give them the option to use some of their vacation or their personal leave days if they want. Those are all kind of the things that Michael was talking about in terms of looking at different options and not using any one.
And that's where communication is going to be important with respect to your policies. It's going to be your ability to direct employees and have them also have full knowledge as to what the consequences are. I know in certain discussions that employees are already, the employees themselves also have concern for their own well-being. They don't necessarily are going to put themselves in harm's way or their family in harm's way. So there are going to be situations where they may be coming to you saying, I need to cancel this. Can I cancel my vacation? Can I reschedule my vacation? And all of those are going to be positive aspects and positive responses that you're going to want to initiate with your employees so that they're not impacting, in fact, doing a benefit service to you. They want to continue working, not be self-quarantined. And if that means that they're taking their vacation in July as opposed to March, regardless of whatever policy might happen, those exceptions can then be made on an ongoing basis based on your needs at the workplace, but also clearly responding to what employee concerns are.
All right, Daria.
Just before I get into this scenario, a point that has come up quite a bit is the opposite of the situation that Lorenzo just mentioned in terms of employees wanting to take advantage of stay home. You have the other situation where some employees can be quite stubborn and think, oh, well, I'm just, I'm sniffly, I have a cold. This isn't symptoms of coronavirus. I actually want to come to work and just ride this out and not actually accept the preventative measures. So I wanted to throw a question out to Michael only because we were discussing it this morning. Can as an employer, you send people home who are exhibiting signs of the flu or cold, and you're just simply not sure what it is?
Yes. Again, you're in control of the workplace, and certainly you should be advising all employees as a matter of course that if they have any concern, if they are ill, if they're exhibiting any signs of any illness, they should be staying at home. They will most likely have the benefits of short-term disability or any sick days that you offer. But if they refuse, or if they are just in the office and there's concern with respect to their flu-like symptoms, you should be directing them, A, to go home, B, tell them to go see a doctor, and C, if they're seeing their doctor, they should, when they're seeing their doctor, they should confirm with their doctor as to whether they're eligible for screening on COVID, and that result, whether positive or negative, should be disclosed to the employer once it's determined. This again, you have your baseline as Lorenzo points out. It is human resources 101 with respect to absences and insurance and sick days, but overlaid with this clearly public safety element that has to be addressed, and that provides you with the enough of the additional due diligence that you can direct these employees to go home.
All right, our third and last case scenario. Employees at Guerrilla Law are very concerned about the coronavirus and in particular worry that they will become infected at work. Lately, there have been loud complaints that certain employees of Asian descent should be banned from work because of the risk. There have also been comments that there will be a work refusal if those employees are not sent home. So the first question is, what are the options for the employees if the complaints become aggressive? The first thing to say on this is that other policies that you have in the workplace still apply. Policies with regards to discrimination and harassment are still at play, and this coronavirus is not an excuse for your employees to act against those policies. So that's the first thing. Lorenzo?
Yeah, and I agree with that. And quite frankly, this really goes to the point of, do we want to get to the point where this is just becoming a panic, right? We know that we still know, even from the numbers that we've seen in Ontario, that it is not at a situation where we're at a panic level. But you need to assess each situation independently. But if individuals are saying with no basis, including whether it's a legitimate work refusal or not, they have no basis upon which to make these comments or use work, you have to go through the process of a work refusal. You have to investigate if there's a joint health and safety, do all of those things right. You're going to get pushback in many cases from individual employees where there's no union, and sometimes from unionized employees where they're saying you don't have the right to do this under the collective agreement. Your best defense in any case is dealing with the policies that you have and making sure that you're complying with the law. That is no different here. And it's the same, what can guerrilla law do in this situation? Well, they can treat it as once the investigation has been taken to find out that there is no exposure in the workplace, or if they can limit it, then they will say to the individual, we've done an investigation with the Joint Health and Safety Committee if necessary, and that's not a reasonable complaint. You're expected to go to work, and any further outbreaks like this will be treated as disciplinary.
That's right. I mean, it's the investigation process as is normal. Again, your policies, procedures, due diligence, you will hopefully have information at that point that, no, we have all these employees have disclosed their travel arrangements and recent travel. In fact, none of them have traveled anywhere. They've been in the province of Ontario for the last 6 months. This is not an issue. And if it persists, clearly there's another, the implication is that this kind of objection is based on another impermissible ground, which then may engage your harassment investigation situation and leave these employees open to potential discipline.
And this is just a response to some of the questions. Like, there are different, if you're in a healthcare facility or you're dealing with patients, and I mean, the framework changes drastically in terms of, we saw this through SARS, and the government has very, very specific guidelines concerning healthcare professionals who are working and who are treating. That becomes a whole different issue because they need to follow protocols from a health and safety perspective in order to treat. But a big part of the questions we're getting is, well, I got one that said, well, what if we're telling people that you can't travel to those areas, and that if you do, you're going to be sent home? And so what can we do? Well, if they're unionized, that might be a grievance, but we're going to err on the side of caution here. And if they're not, we're going to say, well, a self-quarantine is 14 days. If you're taking the position that's a constructive dismissal, those are pretty much all your only damages, or longer if the quarantine ends. But it's a health and safety risk. And I think that's you're on the right side of the gods when it comes to that kind of assessment. So don't be afraid to address those issues. But the bottom line is that from a health and safety perspective, you're obligated to address them. All right. And it doesn't always mean that you don't, but you do have the right to manage the workplace. That has not been eliminated just because we have this fear of coronavirus in the workplace. And then finally, there's a couple other questions that we're talking about, and they really do. Michael, do you have one that you want to address?
Yeah, there's one question that came in with respect to an employee. What happens if an employee says they believe they're infected, or they've been in direct contact with an infected person and then goes home but doesn't go to public health? Again, that's a serious situation. It doesn't impact just that individual, it impacts the workplace. So you're directing that individual to go to public health, get the test, and report the test. It is, again, the accommodation process, the sick leave process doesn't change because of this. In fact, it gets enhanced because of the impact to other persons in the workplace and your own obligations of due diligence under the Occupational Health and Safety Act. And so you can take a much stringent, stronger position with respect to individuals who have self-identified that they have to follow through. And this is also to respond, as Lorenzo points out, to those employees who sort of maybe trying to take this as a 14-day paid holiday. That kind of diligent approach with respect to directing those individuals to provide. We're not talking about the medical certificate in advance of going out, or if they've already indicated they're ill, that they're not immediately going to go to that they're not immediately going to deliver a medical certificate to you. you can be lax and sort of waive with respect to that, but ultimately you want a confirmation, either positive or negative, when they've finally gone to get the testing, because you need that information, because that employee may have gotten in contact with other individuals.
So there's a couple questions, and Daria pointed one out about the wearing a mask, and I'll let her deal with that one. But there's one that I thought was quite interesting, which is the applicability of Workplace Safety and Insurance Act, and whether or not this is during the course of employment. And my view is this: first of all, you'd have to prove that they caught it at work, which is going to be a difficult thing to show, that it arose during the course of employment. But in any event, it's a flu, it's an influenza, that may not be considered a workplace injury in the circumstances. So if people are claiming that, the board will probably address that in accordance with their own protocols. There might be an obligation to file the Form 7 if somebody makes a complaint anyway. You still have to do that, but that should wend its way through the system.
And in respect to the Form 7, of course, put all your objections on the Form 7.
Absolutely.
If someone brings forward that kind of nature, I agree with Lorenzo. This is not an occupational. Typically, occupational diseases, occupational illnesses have to be related to a particular occupation. This is unfortunately is indiscriminate with respect to who it might infect, and so therefore is not associated per se with the workplace, and it typically should not be a WSIB matter.
Okay.
So one of the questions we have, and similar to a few, is what do we tell retail staff? And I think this applies to general employees as well, who want to wear masks. And I'll probably defer to some extent to my senior colleagues here, but it certainly engages a number of issues, including, I think, employers would be worried about this, especially in a retail setting, because it's already worrisome about loss of business, but then you have employees wearing masks, in which case customers may feel like they're wearing masks not as a preventative measure, but actually because they themselves have come into contact or been sick, and this might have further impact on your business. So initially it might seem like a bit of similar to a dress code issue in a way that you direct your employees. However, in this case, because it's related to health and safety, it triggers some accommodation considerations which play into it. So
absolutely. I think that's the right analysis. 2 points on that. Number one is, if an individual, you look to the science that we have right now, which is that a mask doesn't necessarily even prevent that, a person from getting it. It prevents them perhaps from giving it, or it might assist in that way. But that's not necessarily a panacea for saying that we're safe now. But on a retail issue, unless we get to a situation where that might be deemed to be a legitimate health and safety risk, and including to customers and otherwise, I think the answer is that is not necessarily something we need to let you do. But if you have masks, assuming you can get them, and employees who are working in a facility want them because it makes them feel better, give it to them. Right, and if it's not a perception issue, or you're not in the retail, or if the person giving me my coffee at Starbucks is wearing one, right, that might be one thing. If my office mate is wearing another one, it might be another. So I think those are all judgment calls at the time.
Yeah, engage the employee. Why are they asking for the mask? If it's a personal issue, then you should be doing a screening with respect to whether this individual should be at home. Because if there's a concern that they're going to be transmitting it, if there's a concern of the employee that they're on the receiving end, then you have to have a frank discussion with them with respect to, is the mask even going to be helpful in that regard? People don't know how to use the mask. Training would have to be applied. And sort of there's been some talk, not generally, but we've seen it in the United States that runs on masks have done the negative, which is that it's now precluding the people who may actually need it, healthcare providers, first responders, who do need the masks and who are trained to use them, that if there's a run on certain masks for the casual user, it's actually a detriment to other people within the workplace who will need them actually for their own performance of their duties.
Now, when we've got people who are saying I guess we're almost done on time. One final question, which is, what if you're telling people to go home as a preemptive measure? Well, certainly in a unionized environment, they can ask for their wages or pay that they're being asked if there's no reasonable basis upon to do that. And even if a non-unionized employee might say, you're denying me of my wages, like I said before, they might allege constructive dismissal, but it's a 14 to 21 day period. I think that would end it. But again, deal with those on a situational basis and try to be reasonable. And remember, a lot of people are scared about this. I think we're fumbling around in the dark. So let's remember that. So thank you to both Michael and Daria for your time today. Thank you all for joining us. I think this has been really instructive. We probably could have done a webinar for about another 2 hours on this and answered all the questions. But thank you for attending, and we want to invite you and remind you that we are doing another webinar on March 31st at 9:00 a.m. That's a Tuesday, and it's going to be privacy and social media in the workplace, from recruitment to off-duty conduct. So thank you again, and all the best in dealing with this current crisis.